Hello and welcome to this ICAM session. I am Eglė Marija and I will be presenting our research on owner-related barriers to veterinary care and their association with companion animal population management in rural Lithuania. This topic is especially close to me because I have a background in science and I'm graduating in veterinary medicine this year. This is part of my master thesis, but I'm also the founder and director of Miško Trobelė Animal Rescue in Lithuania. So I work a lot with people and their pets in rural areas, trying to prevent unwanted litters, prevent overcrowded shelters, and so on. So why focus on rural areas? In Lithuania, almost 99% of the national territory is rural, and this could be true for a lot of other Eastern European countries as well. About 1/3 of the population live there, but already more than half of the registered pets are outside of the largest cities. And as I will demonstrate later, people in rural areas are actually less likely to microchip their pets. So we believe there could be a lot more dogs and cats in these areas. And we think it's important to focus on pets in rural areas because a large population of animals, poor veterinary care can lead to welfare issues as well as population management issues that spill over everywhere. So our shelters in Lithuania are always overcrowded. There's also always more animals coming in, and we believe it's not coming from the cities, it's coming from outside the cities. But there's a huge evidence gap. So to date, there has been no study of this kind in Lithuania or the other Baltic states. We don't know how do pets enter households. Are most pets strays and so on from unwanted litters? Do people get enough access to veterinary care? Do they get it on time? And whether the preventive practices are routine. So how widespread is microchipping, which is now mandatory in Lithuania as well. Vaccination from rabies, which is again mandatory in our country, even though we don't have rabies, but we have neighboring countries with rabies. So pets have to get these vaccines, as well as neutering, which is one of the main issues in population management. So our study contained online and in-person questionnaires. Altogether, we had 383 respondents participating. Most of them were from rural areas, but in the online questionnaire, we also had 45 urban respondents by accident. But that was really useful because then we could compare. We looked at veterinary care access and barriers, preventive practices, how pets enter households. Also, we looked at information sources that pet owners use, and 85 animals were directly assessed, and their welfare was quantitatively measured. The main limitation of this study was the fact that it wasn't completely random. So a lot of the respondents who were included already approached us to provide free veterinary care, such as microchipping or neutering. So we can understand they are already inclined to get some care and take care of their pets. But we understand that a lot of the people who do not take care of their pets as well were not included in the study. So future research will be needed to understand the issues completely. But this was the first such data set in Lithuania and the Baltic states, and we are very proud to have finally conducted this research. So at a glance, speaking about veterinary access barriers, we actually saw almost 1/3 of the respondents reporting that they have no regular access to veterinary care, whether by choice or other barriers. Over 75% experienced at least one barrier to care, and I will demonstrate some of the important ones a bit later. And what was most interesting and concerning was that almost half of all of the respondents said they saw no need to see a veterinarian or visit a veterinarian more often. And that raised the concern that a lot of the barriers might not be objective but subjective, based on owner perceived need and behavior, which is a lot harder to change, of course. In the rural areas, and perhaps unsurprising, we saw significantly more logistical barriers. Rural respondents reported problems with transportation, so bringing their pets to a veterinarian, whether because it was quite far away or perhaps even more often people just didn't have a car even for a short distance. They also didn't have carriers, or if it was a large dog, they said they cannot figure out how to transport such a dog, even though they have a car, and so on. So a lot of them reported transportation barriers. Quite a bit of rural respondents also reported that there's no veterinarian nearby, which is also understandable because most of the veterinarian practices are based in the largest cities or just outside the largest cities, and it can be difficult to find one in the rural areas, depending where you are. Almost no urban respondents said they had this barrier. And inconvenient clinic hours was also a significant barrier reported by rural respondents. And that can be seen sometimes when a veterinarian just works on request or opens the clinic for a few hours a day, and so on. Again, understandably, no urban respondents reported such issues. However, some of the barriers were quite universal. One of them was cost. All respondent groups, as well as rural and urban respondents, reported at least some concerns with the cost, which is often discussed in the literature, and especially for people in rural areas who are living on very small incomes, cost can be an issue. But what was the most striking is that a lot of the respondents said they do not see the need to see a veterinarian. In the never seen a veterinarian group, 36% said they don't see a need to do it at all. In the regular access group, which means that people have seen a veterinarian with their pet, but on random times or less than once a year, more than half, 66%, said they don't see a need to see a veterinarian more often, which is concerning because even for vaccinations or routine checkups, you should see a veterinarian at least once a year. And those people who did have regular access and saw a veterinarian once or more than once a year also said they don't see a need to visit more often. But of course, this group is less concerning as they already see a veterinarian at least once a year, and that's not as bad. What also we found in the rural areas, which could have been suspected, but finally we can prove it, is that respondents were less likely to take up preventive practices. So only about a half of rural respondents said that all of their pets were microchipped. So again, microchipping has been mandatory in Lithuania for a few years now. However, we only see half or maybe even less, fewer people doing it in the rural areas, which of course prevents us from tracing animals when they run away, when people throw them away, and which does happen, and so on. In urban areas, almost 90% said that they microchipped all their animals, so that was a significant difference. In terms of the rabies vaccination, again, there was a significant difference between rural and urban areas. About 65% of the rural respondents said that they had vaccinated all of their pets. Rabies vaccination is mandatory, but a lot of the people we spoke with in in-person interviews didn't even know that it was necessary, or sometimes they didn't believe that they should do it, that it's necessary for their pet. And that's not even including the other vaccinations which are important for the health of the pets themselves, such as for panleukopenia in cats or parvovirus in the dogs. People will probably vaccinate even less for that. In urban areas, almost 90% said they had vaccinated all their pets for rabies. In terms of neutering, we didn't find a significant difference, only a tendency, so to speak, in the rural areas, but it is concerning that both rural and urban areas are not as active in neutering their pets, that they're not breeding as perhaps they should be. So about only a half of rural respondents said they had neutered all of their pets. To point out some of the risk factors that indicate poorer preventative practices, we found that people with higher education were significantly more likely to microchip, vaccinate, and neuter their pets. In terms of employment status, again, employed people were more likely to microchip and vaccinate their pets. However, it was interesting that we did not find a significant difference between neutering in employed and unemployed respondents. And we can only hypothesize that unemployed people might be thinking ahead and actually trying to prevent unwanted litters and having to take care of more animals just as much as employed people. But this is just a guess. However, microchipping or vaccination is again seen as unnecessary or expensive. We even had respondents who said that they didn't want the responsibility for the animals, so that's why they're not microchipping, which is, again, a red flag. Speaking about how pets enter households, we guessed this before the study, and finally we know that actually most pets, both in rural and urban contexts, come from informal sources, which means that they are strays coming from the streets. A lot of the time they're given by acquaintances or family. Only about 1/5 of all of the respondents said they acquired a pet from a registered breeder. A similar amount said they acquired a pet from a shelter, but most came from informal sources. And rural respondents were also found to keep a significantly larger number of pets, so usually 2 pets or more, which again helps us hypothesize that there's a lot more animals in the rural areas than we know of right now. Why is that important? Rural gaps might create population management risk that flows over to the entire country and maybe even beyond, because there's more pets per household. We see there's inadequate preventative practices, and a lot of the animals come from informal breeding. And that might be one of the reasons why shelters are always full, even though people in urban areas might take better care of their pets, might neuter the pets, prevent litters. Rural areas are a lot less controlled and might contribute significantly to these problems. And what can we do about it is to bring care closer to them. Even though some of the problems are related to owner attitude, we can still make it as easy as possible to access care by providing mobile clinics, visiting certain villages, providing transportation services, which we actually do in our rescue. We can also now know which high-risk groups to target. So rural, lower education, unemployed, and multi-pet households. And bit by bit, we can make care feel necessary. So education is a difficult topic, a difficult thing to achieve. But little by little, we should try to change people's attitude and make them understand that healthy pets also need veterinary care, preventive procedures, and all of them leading to responsible ownership. Thank you very much. This is all for me. I'm waiting for your questions. If you're interested in our work, you can contact me, and I'll be very happy to continue the conversation. Thank you.